It is the midday edition of the Workforce right here on 94.3 WYBC, the rhythm of the city. I'm Wanda Coppage. I have the pleasure of speaking to again. I love when I get to talk to her. I learned so much from Maritza Bond. She is the Director of Public Health for the City of New Haven. She is here with us today to give us all of the information we need about the vaccines that are now available for children ages 5 to 11. So, first, let me welcome you. Good afternoon to you, Miss Bond.
Good afternoon, Wanda. It's such a pleasure to virtually see you. I wish I was in the studio with you.
Yeah, but this works. This still gets the same information out, so we're going to rock with this.
Right, right. One day, one
One
day.
one day, soon and very soon, and it all starts with vaccines and
That's
getting
right.
everyone vaccinated and getting this pandemic over with. And which is why we're happy now that we have children ages 5 to 11 who are now able to be vaccinated. Speak to us a little bit about that process.
So really excited that, as you know, we have been working really diligently in vaccinating the community. We've been having age eligibility groups throughout the year since starting in December of 2020. And so we now have vaccines available that are safe for children 5 to 11. And we have kicked off a campaign so that we're not just offering vaccines, but we're also educating parents on the safe and efficacy of the vaccine. And so we're really glad that we now are able to protect our most vulnerable age group, which people often know that it can also be children.
Absolutely. And now that the children are back in school, remote learning is no longer an option. We're no longer doing AB days. And as a parent of a student in New Haven Public Schools, every so often you do get a notification from your school saying that this child has been tested positive. We're doing the contact tracing. So we're still in that process as well. How do you think this is going to affect, in a positive or a negative way, that process being in school?
So I think for me, one of the things that we do as our team is consistently look at data and look at who's being impacted by COVID, by age group, race, and ethnic groups. And one of the things that we have seen throughout this trajectory is that now in this current phase, our case rate is about eight people per day per 100,000. And we noticed that the two dichotomies that I'm working with that are getting impacted by COVID are 0 to 9 and 30 to 39-year olds. And so we know that the 0 to 9-year olds is a critical group along with the 30-year olds, but especially that we want them to stay in school. And so the vaccine is available through Pfizer. It's a smaller dose than the adult dose amount. And it's basically the half amount. And we want to make sure that it's a 2 dose also. So we get our children vaccinated with 2 doses and they're considered protected 2 weeks after. And so, of course, you mentioned hybrid is not an option. You're not able to do remote learning. We want to make sure that as we reduce the number of kids that are being quarantined, and we know that multiple kids have been exposed and are missing number of days of schools that could be avoided.
Yes. I'm glad you mentioned that it's 2 shots and the dosage is a little lower for the children you mentioned. And you also mentioned data. Can you tell us, off of your research in the data, what it shows as to why it's those two age groups, 0 to 9 and then 30 to 39? What's happening with those specific ones as to why they're most impacted?
So the 30 to 39-year olds is the vaccination rate, and those that are not vaccinated in that age group being impacted. What we are seeing that of cases that are being hospitalized, that the percentage of individuals being hospitalized or contracting COVID are unvaccinated people. From the 0 to 9 group, a vaccine was not available. So now a vaccine is available, and so we want to make sure that we're able to protect and our children and offer a vaccine that is accessible. And so many of the health department and our vaccine providers that are throughout the city are offering vaccines. And the schedule is at least 7 days a week. So we are different partners at different times are offering it. And so we posted those different schedules on our website so that it can be easily accessible for the community.
And what's the website so we can go and see? Because you're right, I see different, wherever you go, pharmacies, churches. My church just recently did a vaccine clinic after the service. So there are a lot of places where people can go and get this vaccine shot. But what's the website so people can get the
If
information?
you can visit our website at newhavenct.gov, and we will be able and click on that COVID hub link, and you will be redirected right to the schedule. Our testing schedule is also on there. And one of the things that we did as a city is that it starts with the community and ends with the community. And that is my motto. Being from New Haven, I wholeheartedly believe that we need to engage the community from the beginning. And so education is also critical, and being aware of the information so that as a parent myself, you can make the best decision for your child.
Right. Well, again, if you're just tuning in, this is Maritza Bond. I don't know why I just wanted to say Dr. Maritza Bond. Maritza Bond,
I
Director of
received
Public
it.
Health, City of New Haven. We're talking about the vaccines that are now available for children ages 5 to 11. And a final question for you in regards to 5 to 11. Where are you with the statistics as to how many have already started receiving this? And do you have any words of encouragement for parents who may be a little reluctant to get their child in that age bracket vaccinated?
So right now the data is still coming in because we just launched our campaign. But what I can tell you is that a lot of parents are coming out. We are being hosted or hosting vaccine clinics, and a lot of parents have been receptive. They've been waiting for the vaccine. Dr. Tamiko Jackson is one of our pediatricians in the city of New Haven who who I work closely with to be able to kick off the campaign. The campaign is actually called "It's Your Turn." It's my turn. It's my turn campaign, and children from the city of New Haven school district have been participating, and so it's really enlightening to see parents stepping up and saying, "Yes, I want my child vaccinated," because we know the detrimental effects that this can have. So,
Absolutely.
as parents, I want to encourage you, or child caregivers, give us a call if you have any questions at the health department. We're here to serve you.
Especially when you have, as most families, multi-generational households, and if one is affected, you put everyone at risk, even if you have been vaccinated. Speaking of the elders in the family, or just anyone outside of that age bracket that have been vaccinated, you also are now offering booster shots. Talk to us a little bit about the boosters and how that affects people.
Yes, so absolutely. So, we want to, as we continue to see the evolving um, variants that are impacting our community, we know that the Delta variant is the most recent one that impacted us early spring, early summer, late spring, early summer. And so we want to make sure that as we continue to open up our communities and open up our cities to and even engaging family members into our homes that are not part of the immediate household members, just getting that extra boost can help us maintain ourselves safe from getting COVID, and not just from getting COVID, because we may get COVID, but is the severity of the disease of having to
Right.
be hospitalized or have a fatality from this disease. And so we hope that you can come out and get that boost. I just got my boost on Friday along with the mayor, and we want to make sure as we gather for the holiday that we are maximizing our protection as much as possible.
I'm glad you mentioned that because I remember just last year holidays were basically amongst everything else was canceled. You had to stay with your immediate family. You couldn't go and visit other as we did before. Now we're progressing. We're going in the right direction. More people are vaccinated. We encourage everyone to become vaccinated. And as you mentioned, Maritza, it's not to give you immunity. You're not. It's not that you're not going to catch the COVID virus. You still could, but it lessens your chance of it being so tragic and you ending up in the hospital and possibly dying from the disease. Is that correct?
Absolutely. And I
Virus.
think that's what we want to avoid. And I think I just want to mention, you also mentioned about our we're engaging multi-generational. And we
Mm-hmm.
have individuals that unfortunately, because they have pre-existing conditions, are not able to get the vaccine
Right.
because of certain immune disorders. And so it's important that we respect those individuals that would like to get vaccinated but are not able to, and we may see them, and we want to be able to protect them as much as possible.
Absolutely. It's the holiday season. It's time for turkey,
Let's cheer
Thanksgiving,
up.
gift giving, and we want to do this in person. Marissa and I were just saying how we're still communicating virtually and not in person as of yet, but soon we will soon get there. We just have to keep going in this direction. We're moving in the right direction, and I have faith in all of us that we will all be responsible, do the responsible thing to take care of yourself and your loved ones around you and your neighbor. So I thank you so much, Maritza, for your time. Anything else you want to add before we
I
wrap
just
it up?
I just want to thank our community partners at large. I For the kickoff of the 5 to 11 year olds. They've done a tremendous job. We couldn't have done it without them. So far they've administered 700 doses to our 5 to 11 year olds. So I just want to thank our community partners for leading this effort with us.
Go on the website, find a location that's close to you, get the babies vaccinated, you get your booster shot, get your
Yeah,
vaccine, even if it's your first one, they're still available. The lines will not be long as they were when they first started. Go ahead, you have no more excuses. Let's do this.
let's
And
do
thank
this,
you
New
so much.
Haven.
Thank you so much, Ms. Bond. All right, you know what's
Take
the midday
care.
workforce? I am Wanda Coppage, your midday host. More great music and more great information for this community after the break.